Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. This evening's topic, I'll talk about the symptoms, causes, and risk factors of the West Nile virus. So, right now I'm going to give you a short overview. Now, if you have the West Nile virus, you will typically show the first virus symptoms within 3 to 14 days of being bitten by the infecting mosquito. Now, around 70 to 80% of people who are infected won't show any symptoms at all. Now, mosquito bites are most common in late August to early September. Now, a mosquito bite can turn into something much more severe if it infects you with the West Nile virus. Mosquitoes transmit the virus by biting an infected bird and then biting a person. Now, not all people with infected mosquito bites get the disease. However, West Nile virus can be more severe for people older than 60 years and people with weakened immune systems. Now, if diagnosed and treated quickly, the outlook for West Nile virus recovery is very good. Now, if you have the West Nile virus, again, you will typically pick up the symptoms from 3 days to about 2 weeks. Now, the West Nile virus symptoms vary in severity. Now, severe symptoms include fever, confusion, convulsions, muscle weakness, vision loss, numbness, paralysis, and coma. Now, a severe infection can last for several weeks. In rare cases, a severe infection can cause permanent brain damage. A mild infection doesn't usually last as long. Mild forms of the West Nile virus may be confused with the flu symptoms because the mild version includes flu-like symptoms such as fever, headache, body aches, nausea, vomiting, swollen lymph nodes, rash on your chest, stomach, and back. Now, infected mosquitoes usually cause the West Nile virus. The mosquito first bites an infected bird and then bites a human or another animal. Now, in rare cases, blood transfusions, organ transplants, breastfeeding, or pregnancy can transfer the virus and spread the illness. West Nile virus can't be spread by kissing or touching another person. Now, anyone who has been bitten by an infected mosquito can get the West Nile virus. However, less than 1% of people who are bitten develop severe or life-threatening symptoms. Age is one of the most significant factors for developing severe symptoms from a West Nile virus. The older you are, especially if you are over 60, the more likely you are to face harsher symptoms. Now, medical conditions that increase your risk of severe symptoms include kidney conditions, diabetes, hypertension, cancer, and impaired immune system. Now, in most cases, your doctor can diagnose West Nile virus with a simple blood test. This can determine whether you have the genetic material or antibodies in your blood associated with the West Nile virus. If your symptoms are severe and brain related, your physician may order a lumbar puncture, also known as a spinal tap. This test involves inserting a needle into your spine to extract the fluid. West Nile virus can elevate the white blood cell count in the fluid, which indicates you have an infection. Now, MRI and other imaging scans can also detect inflammation and brain swelling. Now, because it's a viral condition, and I'm talking about the West Nile virus doesn't have a cure, but you can take over-the-counter pain relievers such as ibuprofen or medicine to relieve symptoms of West Nile virus, such as muscle aches and headaches. Now, if you experience brain swelling or other severe symptoms, your doctor may give you intravenous fluids and medications to lower the risk of infections. Now, research is being done on interferon therapy for West Nile virus. Now, interferon therapy is aimed at using substances produced by your immune system to treat encephalitis in people infected by West Nile virus. Now, research isn't conclusive about the use of therapies for encephalitis, but studies are promising. Now, other potential treatments being researched for West Nile virus related encephalitis include IGIV, MAGWAN1, which is MGAWN1, and corticosteroids. Now, your doctor may discuss one or more of these treatments whether you have encephalitis and your symptoms are severe or life-threatening. Now, here are the facts and statistics regarding West Nile virus. West Nile virus is commonly spread during the summer between June and September. Around 70 to 80% of the people who are affected won't show any symptoms at all. Now, around 20% of the infected people will show some symptoms such as headaches, vomiting, and diarrhea. Now, these symptoms usually pass quickly. Some symptoms such as fatigue can continue for up to 7 months after the initial infection. Fewer than 1% of people who get West Nile virus infections develop severe symptoms or neurological conditions such as meningitis and encephalitis. Of these cases, fewer than 10% are fatal. Now, you can prevent the infection. Every mosquito bite increases your risk of infection. Now, these steps can help prevent West Nile virus each time you go outdoors. Here's what you need to do. Keep your skin covered with long sleeve shirts, pants, and socks. Wear an insect repellent. Eliminate. That's right. You must eliminate any standing water around your home. Now, if some of you live in condominiums or a nice suburban house area, if you see a fountain, because the pond that you see, and I'm going to use an engineering term because I am a civil engineer, it's a sediment pond. And what the sediment pond does, it retrieves all the sediments, and what happens is the sediments go right down to the bottom of the pond, but you see a fountain. The fountain is at that pond to alleviate mosquitoes, because mosquitoes love standing water, particularly if it is damp. I just want you all to be aware of that. That's why you must eliminate any standing water, because mosquitoes are attracted to standing water. Now, you also have to make sure that your home's windows and doors have screens to stop mosquitoes from entering. Use mosquito netting, especially around playpens or strollers, to protect you and your children from mosquito bites. Now, mosquito bites are most common again in late August to early September, so your risk is reduced during colder months because mosquitoes can't survive in cold temperatures. Now, report any dead birds you see to your local health agency. Don't touch or handle these birds. Dead birds can easily pass the West Nile virus on to mosquitoes, which can pass to human beings with a single bite. Now, if any signs of the virus are found in the area around the bird, the health agency will likely increase pest control activity or pesticide use. These actions can prevent the spread of the West Nile virus before it is passed to humans. On the overall outlook, though a vaccine exists to protect horses against West Nile virus, there is no vaccine for people. Supportive care during a West Nile virus infection, especially a severe one, is important to survival. Seek treatment if you notice any of the symptoms described in this video that I presented to you, especially if you know you've recently been bitten by a mosquito or visited a place with many mosquitoes. You are likely to get better quickly and make a full recovery from a West Nile virus infection, but immediate and consistent treatment is the best way to make sure that your symptoms remain mild. This is especially true if you have certain risk factors such as old age or medical conditions. And that's my commentary. for this edition of the 401 Talk Zone radio show for this evening, Friday, June 10th, 2017. You can tune in to the 401 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest calling number is 215-383-5785. If you like my videos, please share and subscribe to the 401 Talk Zone radio show right here on YouTube so I can continue to bring you quality information for educational purposes from a professional and mature perspective. Now, on this channel, I don't engage in controversy, debates, or emotional issues, nor do I participate in drama or unnecessary bickering. Why? Because it's counterproductive. My channel is for educational purposes only. What you get here is information that I research, and of course, I present you with my own personal experiences to show you how the tools can be applied to the real world. Because here, the information is realistic but positive. Because knowledge is power. And if you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. Again, that's lej6521@gmail.com. And if you have a comment, please put your comments at the bottom of the video. But make sure that your comments are pithy, no bloviating, pettifogging, or filibustering, if you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other. Have a wonderful and blessed evening.